Well, there's been much debate over whether Canada should expand MAiD, which is medical assistance in dying, to include mental illness as the sole condition. Joining us to update us on where things are currently at is Daniel Zekveld. He is a policy analyst with ARPA Canada, which is the Association for Reformed Political Action. Daniel, good to have you with us again.
Thanks for having me.
So, Daniel, recently the Special Joint Committee on MAiD tabled a report of its study. So what did the committee recommend on this issue?
Yeah, so the committee recommend indefinitely excluding people with mental illness from eligibility for euthanasia. So effectively an indefinite pause on the upcoming expansion.
Okay, so what does the term indefinite mean? It does leave the possibility open to include mental illness at some point in the future, correct?
It does leave that possibility open, but at the same time, the committee kind of recognizes that Canada might never be ready for the expansion in the future, right? They could have chosen a definite period, maybe a few years, but they decided to go with an indefinite exclusion. I'll note as well, the same committee, or a previous version of it in 2023, recommended a 1-year delay, so that delayed it to 2024. In 2024, they recommended delaying until the ministers of health and justice believed that Canada was ready, so a little bit more vague. And then with this iteration of the committee and their most recent recommendation, that's the strongest recommendation we've had so far. So that's a very positive sign as well.
Okay, so are there any other nations that perform MAiD based solely on the condition of mental illness?
There are a few. Some of the key countries are Belgium, the Netherlands, Luxembourg. The Netherlands, for example, has had what they call psychiatric euthanasia for over 2 decades. And the committee, the Canadian MAiD committee, heard from some Dutch psychiatrists on this issue as well. One Dutch psychiatrist in particular commented that he believes, given some of the distinction between our law and the Dutch law, he believes that Canada's rate of psychiatric euthanasia would quickly surpass that in the Netherlands.
Wow, that's unbelievable. So, Daniel, what are we seeing in these nations? Are the numbers of MAiD increasing significantly because of this allowance?
Yeah, so going back to the example of the Netherlands, where we do have some data, yeah, like I said, they've had psychiatric euthanasia for over 2 decades. For a number of years, there was only a couple cases per year of psychiatric euthanasia. In 2011, there were only 2. But then you get to the 2020s. In 2023, there were 138 cases of psychiatric euthanasia, and then in 2024 there were 219. So all of a sudden, this rapid expansion, and some experts have warned about the problem of suicide contagion, where the availability of euthanasia increases the risk of suicide and the problem of suicide, and of course the kind of conflation between suicide prevention and suicide assistance made for mental illness and suicidality creates other problems there as well.
Yeah, just that availability. I was going to ask you what's happening to see that increase, but that's an interesting phenomenon. Why do they think that Canada would actually surpass that number?
Yeah, so specifically they cite the Netherlands. In the Netherlands, doctors and patients have to agree that all reasonable other options have been tried to resolve whatever their condition is. In Canada, the law says that other options need to be offered and need to be kind of suggested, but none of them need to be tried. So that requirement alone is one that they point to as one that is a bit of a safeguard in the Netherlands that doesn't exist in Canada.
Yeah, I guess so. Maybe one of the biggest problems with allowing mental illness as the sole underlying cause is that, by definition, mental illness would likely impair an individual's ability to make such life-altering decisions.
Yeah, that's certainly one of the big problems. I mean, going back to this question of made for mental illness versus suicidality, some people say that, maybe it can be distinguished. Maybe made for mental illness is this reasoned, informed request, but ultimately, there's no way to distinguish between the two. If
Mm.
someone's not dying and they want to die, there's a lot of factors contributing to that, and there's no way to distinguish a request to die by MAiD from suicidality. And we've seen that with, like I said, the suicide contagion problem as well, where suicide numbers don't actually decrease when MAiD is legalized.
Yeah, exactly. I'm sure you've heard those arguments that if a person wants to die, it should be their right to die, kind of like my body or my life, my choice. Is that what we're seeing here?
Yeah. I think there's definitely that piece. I mean, there's a number of different arguments that people will use. The autonomy question is a big one. The supposed right to die. Some people argue that it would be unconstitutional to not expand MAiD to mental illness. Of course, that's something the courts have not addressed at all to this point. And yeah, just this question that the government can't stand in the way of someone's choice to die.
Is there an argument that this is a safer alternative to suicide?
Yes, that argument has been posed as well. Um, and again, it's that challenge of there's ultimately not much of a difference between MAiD and suicide. It's a request to die from someone who's not dying, and rather than we have suicide prevention in so many cases, but then when it comes to MAiD, it's so often suicide assistance instead.
Yeah. What are some of the arguments, the main arguments being made in favor of allowing mental illness as a qualifying condition for MAiD?
Yeah, so again, the constitutionality question. So opponents to the majority recommendation in the MAiD committee report, they want the Supreme Court to decide on it rather than Parliament. So they're recommending asking the Supreme Court for a reference. And then, yeah, questions about, giving a particular case of someone who's suffering and saying their illness is not remediable, can't be resolved, they are suffering unbearably, and they are not suicidal. So kind of giving a picture of the kind of person that might qualify for euthanasia. Of course, again, there's challenges with those as well, because we've seen so many other cases where, yeah, people's even mental illness can't be considered irremediable or can't be distinguished from suicidality.
Yeah. Do you know what the parameters are in that bill? Like, would anxiety and depression qualify, or does it have to be something bigger than that? Is it like a lifelong affliction, or do you know anything about that?
Yeah, so I mean, there's some conversation about whether to refer to the term mental illness or mental disorder. Mental disorder
Mm.
being a bit more of a distinct category where there are listed mental disorders. In terms of additional safeguards for mental illness, at this point, there would be none. No additional safeguards as opposed to people with disabilities who are accessing euthanasia. Um, so there's no requirement to try treatments for a certain period of time or anything like that.
Interesting. I know one of the points brought up by those against expanding MAiD is that sometimes people can get better. Depression can be a lifetime illness, but some people can find ways to overcome it, and they could change their minds about ending their own life.
Yeah, and we've seen lots of examples of that. I
Hmm.
mean, most psychiatrists in Canada are opposed to expanding MAiD for mental illness. Many of them for that reason, that some of them have treated patients for many years and they seem to not get better and not get better, and then something clicks and they do get better. But even kind of more broadly than that, there's psychiatrists that say, well, psychiatry is about helping people restore hope, prevent suicide, and MAiD for mental illness is the opposite of suicide prevention, where psychiatrists then effectively would give up on a patient and assist their suicide instead.
Oh, interesting point there. And advocates for the vulnerable fear that patients with severe mental illness may feel, subtle societal or even family pressure to request assisted death to avoid being a burden to their loved ones or even the healthcare system. So how do you respond to that?
Yeah, that's something we've seen in the existing MAiD regime in Canada as well. Not something that would just apply to mental illness should that expansion happen. But yeah, we've seen on Health Canada's data kind of tracks why patients are requesting MAiD and what their suffering is. And in many cases, so especially for those who are not dying, so what would be considered track 2 MAiD in Canada, where death is not reasonably foreseeable, over 45% say that they're suffering from isolation or loneliness. And then over 50% say that they think they're a burden on family or friends or caregivers. And that's not the only reason that they're requesting MAiD, but it is certainly a factor in their request. So there's definitely some of these cases. And then we've seen people being offered MAiD in medical settings where they're not looking for it, they're not asking for it, they don't want it, but then they're offered it based on their condition or their illness.
Wow, like how do you even respond to that if you're the patient, and then they might not be necessarily suffering, existentially, but maybe they lack adequate housing or financial support or access to mental health care. I'm sure you've had to address that as well.
Yeah, it's another of the problems with Canada's existing MAiD regime. I mean, just recently there was a story of a man in London, Ontario, who he suffered from Crohn's disease, so he was eligible for MAiD, but he also suffered from mental illness, alcohol addiction. He was socially vulnerable. So there's a lot of other factors that contribute to a person's MAiD request when what they need is help to live well. We've seen actually Alberta earlier this year passed Bill 18, a suite of MAiD safeguards to prevent that kind of situation in the province of Alberta, but certainly throughout the rest of the country, there's not a lot of that kind of safeguard to prevent some of these horrific situations from happening.
Oh, interesting. We're about out of time here, but really quickly, what can viewers do to voice their views about medical assistance in dying to our lawmakers?
Yeah, so the government's going to need to pass legislation to implement the recommendation of the committee. That could be through Bill C-218, which is a private member's bill that was seeking to repeal that expansion. Could be through their own legislation. We're not sure what they're going to do. But certainly send an email to your member of parliament, give their office a phone call, ask them to encourage the government to implement the recommendation of the committee. ARPA Canada runs a campaign called Care Not Kill, and that has a variety of resources and tools as well that can help people take action on this issue. So if you'd like to, visit carenotkill.ca, and you can learn more there as well.
Thanks so much for sharing these details with us today, Daniel. Really appreciate it.
Yeah, thanks again for having me.
You're welcome. Daniel Zekveld is a policy analyst with ARPA Canada.